Hi patient, how are you? Thank you for coming in today. After reviewing your full periodontal chart, x-rays, and basically all your assessments, I would like to go over the results with you in a clear and supportive way for you to understand better. Based on your exam, you have periodontitis stage 3 grade B. This means the infection in your gums has progressed significantly and now is affecting the supporting bones and tissues around your teeth. But of course, what is periodontitis? Periodontitis is a chronic infection that affects the bone and tissues supporting your teeth. Based on your charting, we found periodontal pockets depths ranging from 4 to 8 millimeters, particularly around the back teeth. These deep pockets create an ideal environment for bacteria to thrive, and regular brushing can reach that far below the gum line. Also, your gingival margin is receded in multiple areas, exposing the roots of your teeth. You also have furcation involvement, meaning the bone supporting the space between the roots of your molars is severely compromised, most notable on tooth number 2 on the upper right side and tooth number 31 on the lower right side. You have great bifurcation involvement, which means that bone loss has extended all the way through the furcation, making cleaning and long-term stability more challenging. Additionally, you have a bleeding index of 20%, which tells us that inflammation is present and active in several parts of your mouth. We also observe radiographic bone loss extending into the middle third of the roots of many posterior teeth, confirming that it's not just surface level disease, but is affecting deeper structures. But now, let me explain to you how periodontal classification and progression develops. In the earliest stages, gum inflammation starts as gingivitis, usually caused by plaque buildup, and at this stage, the damage is still reversible with professional cleanings and better home care. But when gingivitis goes untreated, it progresses into periodontitis, where bacteria travel deeper under the gum line and start to destroy the bone and ligaments holding your teeth in place. Now, your diagnosis, stage 3, means the bone loss is now moderate to severe. The presence of clinical attachment loss of 5 or less millimeters, deep pockets, great bifurcations, and possible tooth mobility place it in this advanced state. The grade B classification reflects that this disease is progressing at a moderate rate, not aggressively fast, but enough that without treatment, the damage will continue and may eventually lead to tooth loss. Risk factors contributing to this may include plaque and tartar buildup, irregular dental visits, the fact that you were a smoker before, genetics, or systemic health conditions. Now, the good news is that we have a solid plan to help manage and establish your condition. We will start with scaling and root planing, also known as a deep cleaning. This removes plaque, tartar, and bacteria from beneath your gums and smooths the root surfaces to encourage reattachment of gum tissues. Given bifurcation involvement, we may also apply localized antibiotics like Arastine in those deep areas to help reduce bacteria where mechanical cleaning alone may not be enough. If we find that certain areas do not respond to non-surgical treatments, we may refer you to a periodontist to potential surgical interventions such as flap surgery or regenerative therapy. For home care, when it comes to brushing, I recommend using the modified bass technique, which is especially effective for patients with periodontal disease. Here's how you need to do it. You will need to use a soft bristled toothbrush or an electric toothbrush with sensitive settings. You will need to hold the brush in a 45-degree angle to your gum line. Gently, you're gonna insert the bristles slightly under the gum line, and because this helps to reach the bacteria that collects in just beneath it. We will use surgical motions or gentle horizontal strokes to focus on one or more teeth at a time. We will spend at least 2 minutes brushing, making sure to cover all surfaces, especially the molars where furcation areas are more difficult to clean. Do not scrub hard. Aggressive brushing can cause more gum recession and worsen sensitivity. It's just like that. A soft toothbrush. Additionally, because of the furcation involvement, In deep pockets, I recommend using interdental brushes like proxy brushes for cleaning between molars. These work better than floss in larger spaces. A water flosser, which can help you flush the bacteria out of the deep pockets and around forcations more effectively. You will need to use a daily antimicrobial mouthwash that contains chlorine or essential oils to reduce bacteria. And we will also place you in a 3-month periodontal maintenance so we can monitor your progress and everything basically. I know this may feel like a lot of information, but I just want to ensure you that you are not alone in this, that you already have taken a huge step by coming in and letting me assess your condition. By following through with this treatment plan and sticking to daily home care, we can slow or stop the progression of the disease and help you keep your teeth for many years to come. If you have any questions at all, whether it's about brushing techniques or treatment options, I'm always here for you to support you, and of course, let's work together to get your home health back on track. Thank you.